Okay, so I just made a few notes. Just for context, today is July the 3rd, and it is later in the evening. It's almost 8 o'clock at night, and I wanted to just sit down and kind of record all of my thoughts before I forget anything. I really want to be able to look back on this and kind of see information that I have, because I have found that throughout this journey of TTC and infertility, any of the tests that I've done or anything like that that I've kind of done throughout my process, it's been helpful to have those videos and to go back and see when the tests were done and what my results were and all that kind of stuff. So this is kind of a video to kind of document that. So with all of this being said, yes, Tyler and I finally went to our first infertility clinic appointment, which is so exciting. I told you all in 2020 that I really felt ready to kind of take the next step and to seek out infertility treatment. So obviously when COVID-19 hit, it kind of just put a damper on everything, and I really didn't know if the clinics would be open or what our future looked like. And even though we're still in COVID-19, things are looking a little bit better. It seems like we have more of an idea of what to expect with it, and so I felt comfortable going into the clinic and kind of getting this process started. The clinic that we have chosen to go to, we have went to an infertility clinic before. We only did the initial consultation. It's been about 2 years ago or more when we did that. It really gave us an idea of what this journey would look like, how much it would cost, and the financial impact of that. And it really made us realize that we weren't really in a good position at the time to seek out that treatment or to be able to kind of go through with the process. One thing that I've learned is you have a lot of tests that can be done, and you know, if you don't kind of do the treatment kind of near those tests, you would have to repeat them again, so that could be more money. So I really just wanted to be able to go into the fertility treatment process with the ability to actually have something done. And so over the past year, I did open up an HSA account, which is a health savings account. And I have been contributing to it very minimally, but every payday, so about twice a month. That has allowed me to save up some funds, and the employer that I work for actually does make a contribution into the health savings plan, which is awesome as well. So we've been able to save up a little bit of money, not a ton, but enough to kind of get started, and the ability to be able to do potentially do initial treatments. And so that's what kind of led us to this appointment and finally taking that next step. So the clinic that we go to is about 2.5 hours away. I was thinking it was 3, but it's actually 2.5, so that's great. It's a little bit less of a drive, and that was what we did today. So I want to kind of explain some of my feelings and my thoughts, and just thoughts that were kind of going through my head while I was there, and my experience. When we were making the drive down there, I really felt so nervous, and I haven't really felt like that at any point when I have went to my OB appointments about fertility, or even when we went to that one clinic initially. Like, I just never felt this such an overwhelming feeling of nervousness. Maybe it's anxiety, I don't know. I just felt very nervous, and I think it's just because I didn't know what to expect from what the doctor would tell me of his opinion of what's going on. And I think there's always a fear in that, and I think just realizing that there was a potential for that, it did just make me nervous. I'm very horrible, like I'm really bad with having my blood drawn and all that stuff. It just makes me so anxious and nervous, and so I didn't know if that was a possibility. There's just so many compounding scenarios that kind of made me nervous. So we ended up going into a waiting area, and that was really weird for me. The waiting area was actually pretty full. I mean, everybody was spread apart far enough, like 6 feet. Like, we were all spread apart and we all had masks on. But what was really interesting to me was like the feeling that I got of like just knowing that all of these, you know, women and couples were there together, and like nobody like talked to each other, but it was very like, I don't know, it was so weird to me to just think, you know, we're all on this journey and it just sucks. You know what I mean? Like, it just sucks that all of these people like are having to go through this. And like, I know what I've been through the past almost 4 years, and so to think that they are also going through that. And also I just kept thinking, like, who knows like what they're getting ready to have done. Like, what if this woman sitting here is getting ready to have a big test, or maybe she's getting ready to go talk about results that weren't good. Like, all of those like thoughts and emotions were kind of going through me of like like it just stinks for everybody, you know. And it just kind of puts into perspective, like, we have this community, I feel like, here on YouTube and on my private Facebook group, and there's so many people that are, you know, that watch these videos and that are going through this. But then just like seeing a waiting room full of actual people, like, it just But what also kind of makes me think about that, and what really just kind of sealed the deal of just thinking like I wasn't the only one like thinking about that, was like after we had our initial conversation with our physician, like a long conversation, we went into this like when we were back in the office part, we went and sat down in this little area until we had something else done. And one of the women that was out in the waiting room, when she came by, she was just like she was like, good luck guys. Like, it was just so encouraging. And I don't know, it just made me feel good that like it really does feel like, you know, we're all in this together, and like she knows what I'm going through, I know what she's going through and how hard it is. And that little bit of encouragement was just so nice, you know what I mean? Like, it just was so nice. Like, it was just a kind thing to do. And so I don't know, that just kind of made me think about all the other people there. I don't know why it makes me so emotional. All right, so let's get into what the actual appointment, how it went, and kind of what we did. So the nurse called me back, and I just had like my blood pressure checked, and then I hopped on the scale, got my weight, and then we went back into the physician's office. He had already had like my stuff from my referral information from my OBGYN, and so he had a little bit of information, but I found out that my OB office like didn't send them half of my reports or records that of all the tests and things that I've done, that the semen analysis that my husband's done. Like, he had none of those results, which was really annoying and frustrating, because like it took them, I think, a week or two to make the whole referral. So I'm like, you didn't send over like any of the information, and it took that long, you know what I mean? So now that's one thing, like from the whole appointment of follow-up, Tyler and I have to kind of gather like his results from both of the semen analysis that he has had, and we have to try to get those results back to him so he can review them in depth from his opinion. But basically, I'll kind of show you what he did, which was really interesting and a lot different from the first initial appointment that I had at the other clinic that we went to. So he kind of shows this diagram, which obviously is of a uterus and, you know, the female reproductive organs. So he was very thorough and detailed into kind of how this all works, and then like what the questions are and what the process would be and how we determine what to do next, which was really helpful and very thorough. So he, you know, the top 3 questions that he said that he looks at first was ovulation, or my ovary function, is that there? And based on all, he did ask me a bunch of questions, you know, about my period, all kinds of like questions about my health and my husband's health. And then he went into these. He was like, so there's 3 questions that we want to look at, and that's ovulation. Am I ovulating? Based on everything that I have said, yes. He doesn't really think that that's going to be a problem, but he did get me to do a little blood test for AMH, which he has on here determines ovary function. The second thing is tubes, and I have had an HSG done and everything on that was normal, and based off of other questions, I don't know which ones in particular, he said they're probably okay. The third thing is sperm, the total motile count, and obviously all the different metrics that go into that. He said normal is over 40 million for count, and if it was low, like 15 to 30 million, they would recommend inseminations. And if it was very low, like less than 10 million, he would recommend IVF. So that's just kind of the general thing that he went over with us. And then if all of those things were to be good, the fourth thing would be trying to figure out, do I have endometriosis? The fifth thing would be my egg quality. So I did have I had the blood test done, and I did have an ultrasound done, and he said that basically that could help. If I had really bad endometriosis, you would be able to see that on the ultrasound. And from what he did, he said everything looked really good. I had a lot of follicles, which showed that like I had been ovulating. So that was really positive and encouraging. So what does this all mean? Basically, our next steps and what we'll have to do is I have to gather those other records that he needs to kind of comb over, basically to determine, is it a sperm issue, or if it's not a sperm issue, is it endometriosis? I really don't have any symptoms of endometriosis. However, my mom did have a history of secondary infertility. I don't know that she had endometriosis, but he did say like the most common cause of secondary infertility is endometriosis. And another thing that I never knew was a lot of times they have seen where if you are a twin, that endometriosis is more common in twins. So I think that just by like kind of reading the things that he said and everything, I think he's thinking like endometriosis could be it, or it could be a sperm issue. So he's basically gonna comb through all that information and see what our next steps are. If it would be endometriosis, he kind of just, on the back of the page, he kind of wrote down our options, like what would it be? And he said the first option would be to try on our own, and the odds of that would be about 1 to 2% a month. That is the odds of us actually getting pregnant on our own. And I think he's based that off of the amount of time that we've been trying to get pregnant. And he says, you know, I think after, was it a year? By a year, about 99% of people are able to conceive. He said 4 years, I guess that's where he got the 1 to 2% number. So our odds are obviously not very high on that. He said after about 4 years, there is likely something wrong that's not working properly. Obviously, we're not just going to keep doing that. We've done that for many years now. The second one, when it comes to unexplained infertility, he would recommend ovulation medication and an IUI, which is what I kind of figured. That only increases our odds to 6 to 7% chance per month, which is not that high. But he said if it is a sperm issue, that is probably what he would recommend first. However, if it's not a sperm issue and it could likely still be an endometriosis issue, then an IUI wouldn't really be helpful, because if you don't know if you have endometriosis, it wouldn't be able to, like, it still wouldn't likely work, because you wouldn't be able to get through to that, into the uterus, if that makes sense. I don't even know. I am not clinical. So then, if it wasn't a sperm issue, to determine if it was endometriosis, I would have to do basically a laparoscopy, which is the best way to diagnose and treat endometriosis. And then after that surgery, we could try ourselves naturally. If we tried for about a year, after that, it could increase our chances to 30 to 35% of getting pregnant. So that is also a good option. He said that time is on our side. He doesn't usually have a lot of patients like in their 20s. Most of the time they're in their 30s, and he's having to try to, it's more about like egg quality and all that kind of stuff, and kind of it like beating the time out, if that makes sense. So he said that is a good thing. And then obviously if we didn't try for that 6 to 12 months to see if that would work, he said he did have somebody who was like 26, I'm almost 26, that's what they did, and they ended up getting pregnant right after the laparoscopy. So that is a potential possibility. The only other option after that would be IVF. So that's kind of what we're looking at. Obviously that's a lot of different ifs and what ifs and all that kind of thing. Once I get the records from Tyler's semen analysis that he's had done for him to review, that is really going to determine what direction we go in. So we still don't really know, but we will likely know very soon, which is really exciting to finally be at a point where we can try something and to try to just increase our chances. So overall, I think the appointment went really well. I think Tyler and I both thought it went really well, and we were really comfortable with that physician. We felt like he was very thorough. He took his time with us. He explained everything. So yeah, that is kind of the status update of where we are, what I learned at my first appointment at a infertility clinic, and kind of what's to come. Thank you all for watching, and I will see you all in my next video. Bye guys.